Welcome to our discussion on a critical topic which is impacting individuals, families, and society at large. The topic is on drug abuse and illicit trafficking. Welcome viewers, you're all watching Doordarshan Kendra Kohima. Joining me today on our discussion of drug abuse and illicit trafficking, we have two individuals who are experts in their field. First up, we have SP Narcotics Shinde Suresh, and also we have Dr. Sangdiman Jamir, who is the MO in charge, OST Center and De-Addiction Center at Naga Hospital Authority, Kohima. So first of all, a very warm welcome to both of you. On this discussion, I welcome you all and we look forward to your inputs and expertise on this very discussion. So the first question as directed to Dr. Sangdiman, what are the physical and mental health consequences of drug abuse and how do they vary depending on the substance?
Thank you for having me here. So this question, it's actually quite a big question, in fact. Okay. So I'll try to make it as concise and precise as possible and brief. When it comes to addiction, there are a lot of drugs that people abuse and get addicted to, and then there are various methods of using those drugs. Okay. Say, for example, in the society today, we talk about cannabis. So for a person who takes cannabis, he take it in the form of a smoke or a joint. And then let's say for a person who takes a drug like an opiate drug, something like sunflower, then they inhale those drugs as well as inject those drugs. Then there are drugs such as other sedatives and other hypnotics, methamphetamines. So some of those are being ingested as well. So primarily the physical harm will be will be dependent on the route they take. For example, a person who inhales a smoke will have lung issues. A person who injects will have let's say damage to their blood veins. Not only that, we are also concerned about bloodborne diseases that can be transmitted through sharing of needles and syringes as well. Such as HIV, hepatitis, which is very common in our society today. So again, due to prolonged use of such drugs, especially if you have been an injecting drug user for a long time, then you are prone to get abscess, then which will become into an ulcer. Then later on, maybe if the person does not take proper treatment, if they don't seek proper professional help, then they may develop gangrene and then end up amputating their limbs as well. So when it comes to physical harm, there's a lot. And it really depends upon the type of drug they've been abusing. And then for mental health, it starts with depression. There's a lot of stigma associated with it as well. Then it's not just the common mental health problems that they go through as well. Say, for example, a person who has been abusing cannabis for a very long time. In my experience, people who have been using it for over 10, 15 years, they develop serious mental disorders such as bipolar disorders or schizophrenia, including alcoholics as well. So again, and then people who have been drinking alcohol for a very long time, they develop a condition called as cerebral atrophy, where the size of the brain shrinks, in layman's term. So yes, answering to your question, there are a lot of mental health issues that they go through, from common mental health disorders to severe mental health disorders, as well as physical health, wherein it's really dependent on the drug that they're abusing or they're being addicted to.
Yes, we do see that there are a lot of people who abuse such kind of substance, and then there are a lot of people as well who do know about those consequences. But later on, we see that sometimes people are not aware of those situations that they are putting themselves through. So anyway, thank you for that. Moving on to our Sir Suresh here. Can you let us know about what strategies is the Narcotics Department implementing to control the supply of drugs in Nagaland, and how effective have these efforts been?
First of all, thank you so much for having me here. As we all are aware that our Honorable Chief Minister have declared war on drugs. Yes. After that, under the leadership of our DGP sir, Nagaland police is taking preventive measures to curb this menace of the drug supply in the state of Nagaland. For this, Nagaland police have multi-pronged strategy. Like at the state level, we have constituted ANTF, which is Anti-Narcotic Task Force, which is headed by our Honorable ADGP Law and Order sir. Okay. Under this, we have in every district, we have district ANTF unit, which is headed by the additional SP, who looks after the intelligence-led operations for the seizure of these contraband NDPS substances, as well as collection of intelligence. Also, we are doing frequent MUCP duties, NACA checkpoints, and also based on the surveillance also, Nagaland police is conducting various operations. As we all are aware that in the last week only Nagaland police have seized more than 15 crore drugs in the state of Nagaland.
Okay. All right. Now, moving into more details about how drugs are abused in the society, especially in the context of Nagaland as well. Now, the next question directed to Doctor here. What are the long-term effects of drug abuse on the body and brain? Like you were saying earlier, like the brain has issues like in normal layman, we term it as shrinking of the brain. Can you elaborate more on that? Like, what are the long-term effects of drug abuse on the body and brain?
Okay, so for illicit drug users who have been taking for a very long time, we can observe that they had at one point in their life they have developed ulcers because of using unsafe injection methods. Due to that, the ulcer actually what it does is that it when you develop an ulcer, your skin loses its original elasticity and its strength. In a very larger area. It's not a small spot, but in a big area. So what happens is that I've seen that, and then their veins are more or less damaged. That it's very hard to find veins to inject any form of drug, any form of medicine when they come to us. So that's also a worrisome, that's also a condition that is not favorable for that particular individual, because we have to, if that particular person gets sick for any other disease, we have to find a blood vessel to inject drugs, and then we end up taking that particular person to the ICU to insert a central line that is a line straight into their heart because of the ulcers, because of the damage to their veins. And like I said, for people who have been smoking, inhaling drugs, we can see that they are very prone to lung diseases like pneumonia, TB, and then obviously they expose themselves to infectious disease such as hepatitis, HIV. Like for a disease like HIV, you have to be on the medication throughout your life. Right? It's not a one-time done and deal, medication. So that we should be aware of. And then people who have been smoking cannabis or who have been drinking alcohol or using illicit drugs, we can observe that people who have been doing it for like say 15, 20 years, we can see that their brains don't function as well as the people who don't take drugs. So that also we should be aware of. And then obviously we want them to perform well. We want them to get back to their normal lives. So more or less, especially in people who have been taking cannabis, ganja for a very long time, we have to put them on some antipsychotic drugs or the other, just so that as much as possible they regain their normal let's say functionalities mentally as a human being.
So in relation to that answer, sir, what is the most common drug which is abused in Nagaland?
As far as like the seizures we are getting, so we found that the most important or most profound drug which flows in Nagaland is a sunflower, which is diacetylmorphine, or we normally call it as a heroin. The another drug is like brown sugar, we all are aware. The another is the ganja, which is very common. And the also we found as opium, which is known in some part of Nagaland as a kani, which is I think since ages people are taking. Then latest also we have found some synthetic drugs also, like yaba tablet or spaxoproximine tablet, which are also very addictive, and these are also now started coming in the state of Nagaland. These are the some common drugs we have observed here in the state of Nagaland.
So in regard to that as well, how does the department collaborate with other agencies such as law enforcement and border control to prevent drug trafficking?
Yes, as we are aware that Nagaland being a very close proximity with the Golden Triangle, which is unfamously known for this drug trafficking and all these things. So effective collaboration is much required. So that at the state level, we have ENCODE mechanism where all agencies are the part of that. Like in the context of Nagaland, for border, we have Assam Rifle, which is part of ENCODE mechanism. Then for other agencies like NCB also now started operating in the state of Nagaland in Dimapur. Then other agencies also like various state departments like drug control department. Then we have excise department. So all we are working together. And also we are having a tie-up with the neighboring state also, like Manipur Police, Assam Police, or other state police agencies also. So wherever anyone have any intelligence regarding the supply or trafficking of these drugs, we share with each other and we try to seize that contraband effectively.
All right. Now again, moving on to the health section here, sir, doctor. Regarding treatments and recovery, what treatment options are available for individuals struggling with drug addiction, and how do you determine the best course of treatment? Since you already mentioned earlier about the various effects, like some are affected, the smokers are affected with their lungs, and then so many other categories. Can you elaborate on that as well?
So for the treatment, it is actually tailor-made. That I can say that the one that we are doing in Naga Hospital at the moment, it's a joint decision by the parents or the family members of the patient. The patient should be willing, first of all. He should be willing to give up, and then obviously the medical department, the medical personnel. There are many forms of treatment. We choose the best one that is best suited for him. For example, for an opiate user, there's the opiate substitution therapy. There's another one that is called as drug treatment clinic. There we provide another form of substitution therapy, and there's the inpatient substitution, inpatient detoxification. So it really depends on his needs. It really depends on his, let's say, his situation at home. Some may not be able to afford inpatient detoxification. So we really tailor it as per their needs. And then what we do is that even after the detoxification, we advise them to go for rehabilitation. And rehabilitation is not done in the hospital. It has to be done at an NGO setup. And after that, we we ask them to, be part of some groups like Narcotic Anonymous, Alcoholic Anonymous, so that they're able to maintain their sobriety. So in short, there are various forms of treatment available, and it really depends upon the condition of the patient, the financial or as per the work profile. For example, if it is a student who goes to college every day, they cannot afford to miss class. So it really depends upon the individual, and it is a joint decision made by the family, the patient, and then the medical professionals as well. So
just in relation to that, are there some individuals who often relapse and they return to the hospitals for various kinds of treatments again?
Yes, we have to understand that addiction is a relapsing but medical condition. It's a chronic relapsing medical condition. So this is why we also have sessions with the family members, so that they also understand what the individual is going through. Since it's a chronic disease, and as per research, okay, it says that, you know, for a person to really give up on an addictive substance, it takes more than a year, right? It lasts for a lifetime as well. That it's very easy for them to relapse unless and until they are very careful and very well motivated. So, to answer to your question, yes, patients or clients, they keep relapsing, but they are always welcome, because we understand that it takes a lot of effort, a lot of willpower, and if you fail once, it doesn't mean that you have failed for life. So you can try again and again, and finally we really hope that, you know, this succeed.
And I think it's a good point if an individual comes forward when they do, you know, relapse, you know, for treatment. So now moving on to the next question to Sir Suresh here. What initiative is the department undertaking to reduce the demand for drugs in Nagaland, and how are these efforts being implemented?
Yeah, thank you for asking these questions, because as we all know that prevention is most important thing. So for this, Nagaland Police along with the other agencies and other departments taking various initiatives, like we are conducting awareness campaign. We see in every district there are campaigns like say Yes to Life, No to Drugs are going on. Then we are having various programs in schools, colleges, in churches, along with the various civil society organizations. Then along with the school departments, now recently we have started Prahari clubs, where the school teachers, the students, they are the part, and we are creating awareness with them, like what are the ill effects of drugs and how to get out of it if someone knows to them are having this kind of problems they are facing. The other is like under Nasha Mukt Bharat Abhiyan, in the districts, along with the district administrations, police are taking various awareness campaign, rehabilitation workshops or harm reduction workshops. These kind of initiatives we are taking to reduce the demand. Also to ensure that our youths, they will get the various opportunities, like through sports or through other career related avenues in the different sectors. Nagaland Police is also conducting some workshop regarding that. These kind of initiatives we are taking to reduce the drug demand related
awareness things. And, you know, education is very important in this specific topic. And I think a lot of our youths are also being you know, misinformed, and that's how they get addicted to all this substance abuse, and it all starts from you know, a very tender age. Now also moving on to the next question for Sir Suresh here. What are the biggest challenges facing the narcotics department in controlling the supply of drugs and reducing demand in Nagaland?
For that, like since we all are aware that the geographical terrain of Nagaland as such is a very hilly and dense forest. So and we have more than 215 kilometer international border with the Myanmar also, and the most of the border is porous. So there are various routes through which this drug smuggles in the state of Nagaland, and there are various means also, like the concealment. If you have seen that recently our Honorable Home Minister have shared one video which recently our narcotics team did seizure. They are concealing in such a places in a vehicle that it's very difficult to detect in a small time. For example, suppose if we take the example of this our like Kohima Manipur route, which is going to Dimapur, National Highway NH2. On this road, on an average daily more than 5,000 vehicles are plying. It's very difficult to check each and every vehicle. So this one is the bigger challenge. Another is like if we concentrated on smaller vehicle also, if we think LMV, to check the entire LMV is the another big challenge, because we don't have that kind of resources also, or that kind of expertise also. With respect to demand reductions, as you have rightly pointed out that education is the more important. So we are tying up with all the factors like parents, teachers, which are what we can say that they are the first one who knows that where their child is getting through which direction. So we are creating awareness among them through parent teachers meeting also, or through Sunday church also. So these kind of initiatives we are taking, and these are the common challenges, as we have discussed, we are facing while detecting the detection of this drug trafficking. And also one more prominent things I would like to explain here is that in this drug related traffickings, they works in networks.
Okay.
So if we see that there are forward linkages and backward linkages, and like every node we have cut off, since that persons don't know. If I may explain through example, is like that some person is carrying drug from Senapati, he is having role that he needs to just deliver it to Dimapur. From Dimapur some other person will take, and that person don't know who is that person, because they never share their names, mobile numbers and nothing. Some third person is monitoring, and this financial transaction also happen through Hawala channels, or through some mule accounts. That's why through this medium also I want to request all citizens of Nagaland that never give your account credentials to someone for use, because we don't know tomorrow they are using this for drug trafficking related financing and all these things. So these are the common observations we have observed, and these are the common challenges as a drug law enforcement agencies we are facing while detection of the drugs.
It does look like an intense, workout for the department itself. Now again, moving on to Doctor here. How does illicit trafficking contribute to the drug abuse problem, and what are some potential solutions to address it? Maybe, if the question, we can...
Yes, I think Sir can add to my this thing as well. Actually, there are various studies done regarding controlled substance, and then this like studies were done on some rats apparently, and then a group was prohibited from taking the food was limited to them, and then another group it was freely left. So after a few months, when the let the two groups of rat together, and then where they left the food, the group wherein the food was restricted, they were like they couldn't control themselves having food, and while the group where the food was left like that, so that group of rats, they would take it in their in moderation. So you can see that through that, even through research, we can see that what is prohibited has it's more attractive for the
people. Are more tended to directed towards that.
I think we should we should actually educate our public regarding that, especially that this one is I'm talking in terms of NLTP as well. Because we have a lot of when it comes to drug, alcohol is also a drug as well, and then we have been abusing a lot of alcohol in our state. So my answer to that is regarding that sensitization on how to use and how not to use. When it comes to illicit drugs, I think like Sir was saying earlier, education is very important. And then we cannot say that since a drug is contraband, it is a contraband, it is affecting us. No, any drug per se, even a drug which is like such as a paracetamol, right, which is an over-the-counter drug. I think a person, if they use it not in moderation, they will induce harm to themselves. So I think education is very important in this regard. So I think from the health department, what we would say is like, I think we need to sensitize our public, and then I think the information should be very correct. Actually, we cannot just be vague about the information that we are trying to give out. Some of the schools, they used to reject us trying to be very frank about drugs as well. So a person, we tell the children not to take drugs, but they don't know what is a drug in itself. It's like that. So I think education is very important when it comes to the illicit use, and then its ill effects in our society.
As much as we would, like to discuss further on this topic, and we haven't yet covered a lot of the topics that comes under drug abuse and illicit trafficking. That is all we have the time for today, but thank you all so much for your valuable inputs. Dear viewers, that is all we have for this discussion on drug abuse and illicit trafficking. With our two experts here, we have learned a lot more on the issues that are very much presiding in Nagaland in the context of drug abuse, and maybe through the various factors that come through it, and also the consequences of abusing drug and various substances. Like our experts have shared, education and awareness is the most priority that needs to be given out to the public forefront, starting from our families, our schools and colleges and various institutions. So let's all keep that in our mind and also start practicing, various forms of awareness and the right information. That is all we have for now. Keep watching Doordarshan Kendra. We will be posting many more updates and information on all kinds of important issues. This is Nufu Iyer signing off for Doordarshan Kendra, Kohima. Thank you.